everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Oxybutynin. Its brand name is Ditropan. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So oxybutynin causes relaxation of bladder smooth muscle by reducing the muscarinic activity of acetylcholine on smooth muscle. In terms of indications for use, this medication is indicated to be used in the treatment of bladder muscle dysfunction, typically when the bladder is overactive. And oxybutynin can also be used to treat neurogenic bladder. Now before somebody was to use oxybutynin, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. If a patient had a hypersensitivity to oxybutynin or any other component of the product, they would not be able to use this medication. Patients with known or at risk of gastric retention cannot use oxybutynin. As well, patients with known or at risk of uncontrolled narrow-angled glaucoma cannot use this medication. And finally, patients with known or at risk of experiencing urinary retention cannot use this medication. Now, in terms of precautions, this medication is on the Beers criteria, which is the list of medication that the elderly population should either avoid or use cautiously. We would want to avoid giving this medication to the elderly population if they have delirium or are at risk for developing delirium, because this medication may worsen or induce delirium in these patients. And we would also want to avoid giving it to elderly population who has dementia or cognitive impairment due to some CNS adverse effects that they may experience. We would want to use this medication cautiously in patients who have congestive heart failure, coronary artery disease, cardiac arrhythmias, tachycardia or a rapid heart rate, and hypertension, as symptoms may be aggravated. We would also want to use this medication cautiously in patients who have hyperthyroidism for the same reason, because symptoms may be aggravated. Caution must be used in patients who have gastrointestinal obstructive disorders due to the risk of gastric retention. It should be noted that anaphylaxis and other hypersensitivity reactions have been reported with the use of oxybutynin. Some CNS adverse effects, such as hallucination, confusion, agitation, and somnolence have all been reported, and we would especially want to monitor for these during initiation of therapy and during dose increases. We must use caution giving this medication to patients who have prostatic hypertrophy because symptoms may be aggravated. And lastly, it should be noted that angioedema, which could be severe or sometimes life-threatening, has also been reported with the use of oxybutynin. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use oxybutynin, they can expect to receive their dose orally. If somebody is using the extended-release tablets for a bladder muscle dysfunction or an overactive bladder, they would typically use 5 or 10 milligrams once daily. The dose can then be increased each week by 5 milligrams to a maximum dose of 30 milligrams per day. If somebody is using the immediate release formulation to treat neurogenic bladder, they would typically use 5 milligrams 2 or 3 times daily, and the maximum dose would be 5 milligrams 4 times daily. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using oxybutynin, so I'll go over some of those here now. 9% of patients may experience constipation, and 8% may experience diarrhea. Indigestion can happen between 4 and 6% of the time. Nausea can happen up to 12% of the time, and dry mouth can happen up to 72% of the time. 16% may experience dizziness, and about 7% may experience a headache. Somnolence can happen between 6 and 14% of the time. Now, some more rare but serious side effects would be anaphylaxis or some other hypersensitivity reactions, confusion, agitation, or hallucinations, and finally, angioedema. That's all we're going to talk about today with oxybutynin. As always, I'm very thankful you took the time to go by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.